Welcome to another insightful episode on PsyEduInsights, where psychology meets education. We are devoted to sharing profound insights into the intriguing realms of psychology and education. A comprehensive understanding of psychological disorders is crucial for fostering a well-rounded approach to education. With every episode, we aim to unravel the complexities of the human mind and its influence on learning. Today, we delve into the complex world of trauma and stressor-related disorders. Trauma and stressor-related disorders, a term that may sound complex, but it's something many of us might have experienced in our lives. These are psychological conditions that arise when an individual has difficulty coping with or recovering from a traumatic or stressful event. This could range from natural disasters and violent crimes to personal loss or even a severe accident. In essence, these disorders are the mind's response to overwhelming stress. They can manifest in various ways, such as intrusive thoughts, emotional numbness, or even physical symptoms like heart palpitations and tremors. The impact is profound, often leading to significant disturbances in the individual's daily life. It can affect their ability to work, maintain relationships, or even carry out basic tasks. These disorders are not just about feeling stressed or upset. They are serious mental health conditions that require understanding and professional treatment. But how do we diagnose these disorders? The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, fondly abbreviated to DSM-5-TR, is a compass guiding us through the complex landscape of mental health. It provides a comprehensive guideline for diagnosing a multitude of disorders, including those born from trauma and stress. Let's delve into the diagnostic criteria of these disorders as outlined in DSM-5-TR. The first key criterion is exposure to a traumatic or stressful event. This could be a single event or ongoing persistent stresses. It's important to note that the individual doesn't necessarily have to experience the event themselves. Witnessing it happen to others or learning about a traumatic event that occurred to a close family member or friend also qualifies. Following exposure, intrusive symptoms may emerge. These might manifest as recurrent, involuntary, and intrusive distressing memories of the traumatic event. In some cases, the individual might have distressing dreams or even flashbacks where they feel or act as if the traumatic event were recurring. Next, we have avoidance. The individual might start to steer clear of stimuli associated with the traumatic event. This includes both thoughts or feelings and external reminders such as people, places, conversations, and activities. Moving on, negative alterations in cognitions and mood associated with the traumatic event are another key criterion. This could involve an inability to remember important aspects of the event, persistent negative beliefs about oneself, others, or the world, and persistent negative emotional states such as fear, horror, anger, guilt, or shame. Lastly, we have alterations in arousal and reactivity. This might look like aggressive, reckless, or self-destructive behavior, hypervigilance, exaggerated startle responses, problems with concentration, and sleep disturbances. Remember, these criteria serve as a guideline. Each individual's experience with trauma and stressor-related disorders is unique and may not tick every single box. This is why professional assessment is crucial. Diagnosis is only the first step. Recognizing the symptoms in everyday life is equally important. Symptoms of trauma and stressor-related disorders can often manifest in subtle ways in our day-to-day lives. This is why it is crucial to recognize these signs, not just in ourselves, but also in those around us. Let's start with flashbacks. These are sudden, often vivid recollections of traumatic events that can occur without warning. Picture this. You're walking down a peaceful street when, out of nowhere, a car backfires. To most people, it's just a loud noise. But to someone who's experienced a traumatic event, like a war veteran, this sound could trigger a flashback, causing them to relive the frightening moments of a battlefield. Next, we have nightmares, which are not just your typical bad dreams, but intensely realistic and distressing dreams related to a traumatic event. For example, a person who has survived a car accident might repeatedly dream of the crash, waking up in cold sweat, heart pounding as if they were there again. Then there's emotional numbness, another common symptom. This is a kind of self-defense mechanism where the person emotionally detaches from their surroundings and feelings to cope with the distress. Imagine a victim of a natural disaster who, despite losing their home, appears indifferent or unresponsive to their loss. That's emotional numbness. Finally, let's talk about difficulty concentrating. This isn't just about losing focus while reading a book or watching a film, but a constant struggle to stay focused on daily tasks. A student who has experienced bullying might find it hard to focus on their studies, their mind constantly drawn back to their distressing experiences. All of these symptoms can deeply impact a person's quality of life, affecting their relationships, work, and overall well-being. But recognizing these symptoms is the first step towards seeking help and initiating a journey towards healing. And what causes these disorders? There's no single cause for trauma and stressor-related disorders. It's usually a combination of several factors. Let's delve deeper into this. One major cause is experiencing a traumatic event. This could be witnessing or being a victim of a violent act, a natural disaster, a major accident, or war. These events can cause a person to feel intense fear, horror, or helplessness, which in turn can lead to the development of a trauma or stressor-related disorder. Childhood abuse is another significant cause. This could include physical, emotional, or sexual abuse. The impact of such experiences during the formative years can lead to a lifelong struggle with these disorders. For instance, a child who has been physically abused may grow up to experience intense feelings of fear and stress, even in safe environments. Genetic factors also play a role. Some people may be genetically predisposed to react more intensely to stress, making them more susceptible to these disorders. Just like hair color or height, our response to stress can be influenced by the genes we inherit from our parents. Environmental factors are another piece of the puzzle. Living in an environment where violence, abuse, or neglect is commonplace can increase the risk of developing these disorders. Imagine living in a war zone where the threat of violence is constant. This can create a chronic state of stress, which can lead to trauma and stressor-related disorders. But it's not just about the negative experiences. Lack of social support after a traumatic event can exacerbate the impact of the trauma, making it more difficult for the individual to cope and recover. Having a strong support network can be a protective factor, helping to buffer against the development of these disorders. It's important to remember that these are potential causes. Not everyone who experiences these circumstances will develop a trauma or stressor-related disorder. It's a complex interplay of various factors, and it varies from person to person. While these disorders can be challenging, they are treatable. So if you or someone you know is struggling with these issues, don't hesitate to seek professional help. There's always hope for recovery and healing. Treatment for trauma and stressor-related disorders can be a beacon of hope for many. When faced with these disorders, it's important to remember that you're not alone, and there are many treatment options available. One of the most common treatment approaches is psychotherapy, also known as talk therapy. This involves speaking with a mental health professional, such as a psychiatrist or psychologist, about your experiences and feelings. The goal is to help you understand and manage your symptoms and to develop coping strategies for daily life. Cognitive behavioral therapy, or CBT, is a type of psychotherapy often used. It focuses on changing negative thought patterns that can contribute to feelings of stress and anxiety. In addition to psychotherapy, medication can also play a role in treatment. Psychiatrists may prescribe medications to help manage symptoms such as anxiety, depression, or insomnia. These can include antidepressants, anti-anxiety medications, or sleep aids. It's important to remember that medication is usually most effective when combined with psychotherapy. Self-care strategies are another key part of treatment. This can include things like regular physical exercise, maintaining a healthy diet, getting enough sleep, and taking time each day to relax and do things you enjoy. These strategies can help to reduce stress and improve your overall well-being. Lastly, support groups can provide a safe space to share experiences and feelings with others who are going through similar challenges. This can help to reduce feelings of isolation and provide a sense of community and understanding. It's important to emphasize that seeking professional help is a crucial step in the treatment process. If you are experiencing symptoms of a trauma or stressor-related disorder, reach out to a mental health professional. They can provide a diagnosis and guide you towards the treatment options that are best for you. Remember, it's okay to seek help and take care of your mental health. That's a brief overview of trauma and stressor-related disorders. We've delved into their definition, diagnostic criteria as per DSM-5-TR, recognized symptoms in everyday life, causes, and available treatments. Knowledge is power, and sharing it multiplies this power. So, Don't hesitate to pass along this video to those who might find it enlightening. Remember, understanding begins with awareness. Thank you for joining us on this journey of understanding. Don't forget to subscribe to PsyEduInsights for more educational and psychological insights.